Hey everyone, Dr. James Stirrett here. So excited to see you today, and I am pumped to be talking about testosterone replacement therapy. We're going to be going over the 5 key reasons that testosterone therapy does not suck, and you should consider it if you are a male that is over the age of 35, 40 years old and is struggling with low testosterone symptoms. So what are low testosterone symptoms? Mostly, I like to look at this in the term of motivation. Guys and women, believe it or not, I'm going to be talking about guys today, but men and women can experience this, where they're just feeling like their overall drive, and I'm not talking just about sex drive, I'm talking about their overall drive in life, daily motivation, reason for getting up out of bed, overall sense of well-being is just diminished with low testosterone. Most of the time, guys just feel like they're stuck in a rut. They're not recovering very well. Maybe they've gone to the doctor and they're starting to accrue some medical conditions like, hey, your cholesterol is rising. Like, hey, you need to start watching your weight. So guys will start to notice like a little bit of muscle mass loss, maybe a little bit of fat gain around the midsection. Just noticing that they're not feeling like they're thriving. They're feeling like they're crashing during the day. They'll get home after work and they're just dead tired. And it's like, oh my gosh, another day. And it's like they feel like they're just stuck in this washing machine, this endless cycle of life. And I just call this the rut. This is the low testosterone rut that a lot of guys experience. Now, of course, there's other symptoms too. A lot of guys will notice sexual dysfunction, erectile dysfunction, low libido, poor sleep, and a wide variety of other symptoms. But those are really the main ones that I see. And when I talk to guys and they're telling me like, hey, I'm so tired. I'm not motivated. I'm gaining weight. I just don't feel motivated to make any changes in my life. Libido's down. Of course, another thing that you'll see is like a lack of morning erections. So there's a variety of things that can happen. But when a guy starts to tell me these things, like I already know before I check the labs that the testosterone is going to be low. Now, I'm seeing this in guys as young as 25, 30 years old. I myself am 34 years old, and I've seen my testosterone levels crash down when I went through a tough time in my life. And so I know that it's possible. It can happen to anybody, and it is recoverable. Now, there are certain reasons why a person would not want to do testosterone therapy, and my number one indicator for a person that does not need to do testosterone therapy and should not do testosterone therapy is somebody that is looking to conceive in the immediate future. The way that testosterone works is that it actually shuts down your own testosterone production. It decreases your own testosterone production to some degree. And because of this, the process, that the feedback system that takes place will actually decrease sperm counts. So if you're somebody who is looking to conceive, this isn't the best option for you. I would like to consider other forms of other therapies that are also helpful for boosting testosterone. Now, if you're somebody who's over the age of 40, you've already had kids, you don't want any more kids, or you're not wanting children, then testosterone therapy can be an amazing option. So I'm going to be sharing 5 things with you today that make me feel like testosterone does not suck. It does the exact opposite. It amplifies your testosterone levels when done safely, puts you back in a normal range, and can really put you back in the game physically, mentally, emotionally when it comes to your well-being in your life. So reason number 1 is that testosterone is a hormone, and a hormone is just basically something that's released from one organ system, travels in the bloodstream to another, and has an effect. So what happens with testosterone is it's actually in men, it's produced in the testicles. The brain is telling the testicles to produce testosterone. Testosterone is released. And what it does is it has it goes through the bloodstream and it has target actions on cells to recover, namely. It has many different actions, but mainly what I'm thinking about here for you guys is its capability to regenerate cells. It actually physically goes into target cells and causes this regenerative process to occur, which is one of the reasons why I believe that testosterone is namely one of our biggest anti-aging hormones out there. think about this from a workout perspective. Somebody that has no testosterone levels, like next to none, versus somebody who has optimal testosterone levels, I mean, the recovery is going to be drastic between the two. If no testosterone, you're not going to barely recover at all. And this is why I tend to hear guys say things like, man, I have a workout and I'm just sore forever and I feel unmotivated and I don't want to work out. It's like, I've been working out for months and I just don't see any results and I'm tired and I just don't want to do this anymore. The weight's not coming off. I'm not seeing any changes. And I'm like, low testosterone, right? Because the guy that has normal testosterone levels sees gains in the gym and is going to feel motivated. The more they work out, they're going to feel like getting up and working out, and they're going to feel that motivation and drive, because testosterone is a hormone of drive. But namely, it's because of this recovery concept. I mean, no one's going to want to work out if you work out and then you're just sore forever. So number 2, testosterone does not do the harm that people think that it can do. And I think that, in the past, 20, 30 years, a lot of the studies that have been done with testosterone have been really poor studies. And so we have we're really scared of it. Like, oh my gosh, if you're on testosterone, it's going to, give you rage, or it's going to give you acne, and it's going to give you increased likelihood of a stroke or heart attack, or it's going to it's going to make your prostate enlarge. It's going to do all this stuff. And what I can tell you is that anecdotally in practice and seeing thousands of men, I've literally seen and treated thousands of men on testosterone therapy. I have seen all of the reverse happen of all of these things, where I have not had one single man have a cardiovascular event. And many of these men are over the age of 50. No cardiovascular, no heart attacks, no strokes, no cardiovascular events at all. In fact, I've seen the opposite be true, where a lot of these people that have had certain diseases have actually started to reverse. Prostate is another one that comes up frequently. I've had most of the guys on testosterone therapy that have struggled with their prostate actually have had things improve, because they improve their diet, their lifestyle, drinking less alcohol, consuming less sugar, drinking less coffee. And then on the testosterone therapy, they've had their BPH symptoms, or benign prostatic hyperplasia or hypertrophy, basically where the prostate swells, has improved while they're on the testosterone. Number 3, testosterone therapy does not suck when you do it correctly. So many of these testosterone therapy clinics out there, I see so many patients, they'll come to me and they're like, I'm on testosterone therapy, I don't feel great. I'll check their labs. They're overdosed or they're underdosed. They're on way too much testosterone, and that is not a way to make somebody feel good. A lot of bodybuilders will abuse testosterone, and it will cause tons of issues. It will cause urinary issues. It will cause acne. It will cause just skin changes. It can cause the need to be on estrogen blockers. This stuff is not necessary if you just dose testosterone correctly. So don't get your testosterone on the black market. Come to a provider like myself or a functional medicine doctor that understands these things, understands hormones intimately, so we can actually prescribe you a dosage that's correct for you and your body, right? So, if you're looking at the testosterone levels, let's just think about things in terms of your total testosterone levels. A lot of guys that I see are under 250, and we just want to get those levels up closer to 800 to 1,000. And when you test really matters. So let's say that you're injecting testosterone once a week, right? And you get your blood drawn on your injection day right after you inject. Your levels are going to look like they're way too high, because you're injecting once a week. The levels start here and they're going to taper down throughout the week. So what you want to do is you want to inject let's say on a Sunday, and then you want to get your blood checked midweek. So 3 to 5 days after injection. So if you inject it on a Sunday, that would be like a Thursday blood draw. And so that way you would have a representative median of what's happening with your blood. So for those of you out there who are on testosterone therapy who are not doing it this way, then this makes a big difference. Now, the other thing that I'll recommend here is that testosterone therapy does not suck, and I'll add this in, when you are doing not just the dosage correctly, but the form correctly. A lot of people are doing creams, they're doing pellets, and I'm not going to go into all this, but you guys, injections are the way to go. The reasons why are because it's controllable, and we can stop at any time. We can start or stop at any time. and it just gives us the most flexibility to get you the best dosage possible. And I will tell you one thing, that when you inject testosterone, it tends to stay as testosterone instead of becoming estrogen or other metabolites that like DHT, or basically like souped up versions of testosterone that can have other impact on the body that we don't necessarily like when we're prescribing testosterone therapy. So injections really are the way to go. So number 4, this is probably one of the most important things to note about testosterone therapy. Research shows that in men with lower testosterone, all-cause mortality goes up, which means that men tend to die for no particular reason more often. So guys with low testosterone have a higher likelihood of dying for any reason when their testosterone levels are low. We've just seen that across the data through meta-analysis. So it's very clear, like, okay, guys tend to have more health issues and die for various reasons when testosterone is low. But we can extend that a step further. Cardiovascular disease tends to be more rampant in men with low testosterone levels. Alzheimer's disease, so neurological conditions and cardiovascular conditions both tend to be worse, and men have a higher likelihood of dying from them when testosterone is low. So this blows my mind for a second. Let's take into consideration somebody who's with early onset Alzheimer's, or somebody with early onset cardiovascular disease. Some doctors might be very, very skeptical about testosterone and say, no, we don't want to do testosterone therapy. It could increase their likelihood of thromboembolism, of a stroke, of a heart attack, yada, yada, right? But that's old research. Newer research is showing that these things are likely not increasing problems. And in fact, they're likely going to do the reverse in that. Some of this research shows that atherosclerosis in the arteries tends to reverse on men who have their testosterone corrected, which means that somebody with active disease in their arteries all of a sudden goes on testosterone therapy, and now we're seeing that plaque start to clear out of the arteries. These conditions, a lot of them are reversible, and I know something like Alzheimer's, that is a condition where it's very complicated, but don't we want to be doing anything that we can and as safely as possible? And I would argue that testosterone therapy is one of the best and most impactful therapies that someone like facing these types of conditions could add into their arsenal of treatments because of the regenerative capability of the testosterone. So this is going to segue into number 5, which is essentially testosterone helps to reverse metabolic syndrome. So we know very, very clearly that metabolic syndrome, diabetes, weight gain, these are things that make cardiovascular disease worse. These are things that make Alzheimer's worse. Alzheimer's has been called diabetes of the brain, right? We know that metabolic syndrome makes people die faster at the end of the day, right? And so what if I could say that testosterone therapy helps decrease metabolic syndrome? Now, in the research, I would say that this is less correlated, but there hasn't been a great deal of research done on this. However, what I've seen in my practice, anecdotally, is that almost every single time I put a guy on testosterone therapy and they have metabolic syndrome, their blood sugar gets better. Their blood pressure comes down. Their blood sugar gets better. They start to lose weight. They start to gain more muscle. Okay, these are all amazing things. Their cholesterol starts to come down. How would you see all of that with just testosterone therapy, right? You could argue like, well, testosterone doesn't directly impact all of these systems, but it actually does in a roundabout way. When you give an individual increased drive, increased motivation, increased need to work out, increased need to, and what happens when you want to work out? What happens when you have an increased sense of well-being? You want to take care of yourself. You want to eat better. You want to take better care of yourself. You want to get more sleep. You want to eat, the proper nutrients that are going to fuel your body. You're not going to want that ice cream. You're not going to want those late evening snacks, popcorn and crap snacks and pop and all that stuff that's going to be terrible for you at the end of the day, right? You want to take care of yourself more overall. This is all induced by just simply putting on someone on testosterone therapy. It just makes them feel better to make the choices that they need to make to be a better individual, to be a healthier individual. And as a result, I believe that is what brings down the blood sugar. That is what helps people start losing weight, brings down cholesterol, brings down, gets people off their blood pressure meds. This is the stuff that really makes a difference at the end of the day. And that is why I am a huge advocate for testosterone therapy. I cannot pick another therapy in the last almost decade of practice that has been more impactful for people's lives other than testosterone therapy. Now, of course, there's reasons why you wouldn't want to be on it. If you want to be fertile and you want to be having kids, not the right therapy for you. If you have active sleep apnea and you don't want to wear that CPAP machine, not the right therapy for you. I've got patients that are in their 80s. I got patients that are pushing 90, and they have told me that testosterone therapy has literally been the game changer that brought their vitality back, that has gained them, just like gave them like the zest of life back in those later years. So anyways, obviously I'm passionate about it. If you are interested in testosterone therapy or you're interested in getting your testosterone levels checked out, feel free to click the link and, you can always schedule an appointment or get seen. But I do encourage you to, any guy above the age of 30 should always get their testosterone levels checked, especially if they're just feeling like, life is become redundant and they're tired and their sex drive is waning and you're just not feeling motivated anymore. Check your testosterone levels. There's so many things that we're subjected to that decrease our testosterone. Anyways, guys, if you guys enjoyed this, go ahead and click that like button for me, and please subscribe if you want to see more hormone-related content, health-related content. Again, I'm Dr. James Stirrett, and I really appreciate you being here. Take care, guys. Till next time.